Good afternoon, everyone, and a very warm welcome to this Euractiv debate under the title Beyond the Stigma, How Can Europe Improve Support for Women and Postpartum Mental Health? My name is Ana Gumbau, and I'll be delighted to be moderating this important discussion today. I see many of you joining us in person, as well as many of you joining us online in this event that's been supported by Biogen. So the way that this event is going to go tonight, we're going to start with a round of statements. We are going to hear from our distinguished panelists, and then we will have time to answer as many questions from you in the audience as we can. We are going to be able to ask all and any questions using Slido, which the code that is going to be appearing right now in our screen. You can scan the QR code or use the hashtag PPD on slido.com to ask any questions. So the reason why we are hosting this event is because 1 in 7 mothers have had suffer from postpartum depression, and it's a topic that has been increasingly being featured in the media. We've been seeing from actors at international level to sportswomen recognizing the need to put more attention into this subject, and the European Commission and different member states have come with several sets of initiatives to tackle that. We've been seeing many steps in the right direction. However, much more support is still needed. So we are in fact going to be starting with a message from a member of the European Parliament, Vytenis Andriukaitis. He's a member of the European Parliament from Lithuania, from the S&D group, who is going to give us some welcome words since he couldn't be with us, but still wanted to send a message. So on with the video.
Dear colleagues, dear friends, let me begin by thanking Euractiv and all partners for putting maternal mental health at the center of today's discussion. I am sorry I cannot be with you in person, but I am very glad to contribute to this very important debate. Across Europe, every new mother should have the right to health, dignity and support. Yet many women experiencing postpartum depression are still not recognized, listened to, nor properly treated. This is not only a medical issue. It is a question of gender equality, social justice, and fundamental rights. For us, the Socialists and Democrats, the message is clear. Health must be a political priority across all policies. In October, the S&D group adopted a position paper, Health as a Priority Across All Policies, where we spelled out our vision for a comprehensive European Union women's health strategy and for closing gender health gaps across the European Union. Women in the EU continue to face deep and systemic health inequalities, driven by discriminatory social, economical, and biological determinants. Too many women live with conditions that are under-researched, underfunded, and misunderstood, leading to delayed diagnosis and substandard care. This is true for many female-specific conditions. That is why the S&D group calls on the European Commission to come forward with a comprehensive European Union women's health strategy and an action plan. This includes ensuring quality, free and timely access to sexual and reproductive health services, information and counseling, modern and affordable contraception, antenatal, childbirth and postnatal care, psychological support during fertility challenges, and universal maternal health care. All of these are part of the foundation of good mental health for women and new mothers. We also insist that mental health must be an integral part of women's health strategies, with tailored mental health services across the whole spectrum of reproductive experience, from menstruation to pregnancy, childbirth, and pregnancy loss. Postpartum depression is a particularly acute example where lack of recognition and stigma can have serious consequences for mothers, babies, and families. But we need concrete steps, not just good intentions. First, systematic and equitable screening and follow-up for mental health during pregnancy and after birth, so that no woman is left behind because of her postcode. Second, better access to multidisciplinary, gender-sensitive care, from midwives and primary care to mental health professionals with clear, easy-to-navigate pathways. Third, investment in research, data, and innovation on women's health and perinatal mental health to close the gender data gap and ensure that policy and care are based on robust evidence. Fourth, strong support for civil society and parent-led organizations that combat stigma, detect problems early, and give women a voice. The European Union has started to recognize these issues, but we have not yet matched that recognition with sufficiently ambitious and coordinated action. This must change. Your discussion today on how to move forward beyond stigma to real solution is crucial. I encourage you to be concrete, to be bold, and always to keep mothers and families at the center of your recommendations. Thank you for your commitment, and I wish you a productive and impactful discussions.
Thank you very much to Member of the European Parliament, Vytenis Andriukaitis, for opening our event. And I think we are starting with a very strong message that we need to move beyond the stigma to real and tangible actions to tackle postpartum depression. So let me begin by welcoming our panel who will be joining us today. We have a hybrid event, so some of us will be speaking online, some others are here sharing the stage with me. Let me start by welcoming, joining us online, the head of the area for promotion and prevention at the Mental Health Commission at the Ministry of Health in Spain, Clara Benedicto. Joining us as well online is the Director General at the European Institute of Women's Health based in Ireland, Peggy Maguire. Welcome. Also joining us in person over here is the head of the European Delegation and Vice President at Make Mothers Matter, Joanna Shima. Welcome. Joining us online is the Associate Professor for Midwifery Sciences at KU Leuven, Annick Bogaerts. Welcome. And last but definitely not the least, we have the Managing Director at Biogen France, Marina Vassiliou. Welcome. So I would like to start by asking each one of you, what are the most promising developments that we have seen either at European or at national level in recent years when it comes to awareness and concrete actions to tackle postpartum depression? I would like maybe to start with Clara Benedicto, if you could bring some examples from Spain.
Yeah, thank you. Thank you for having me, and sorry for not being there at Brussels. But from the Spanish point of view, the Commissioner of Mental Health Office was created less than 2 years ago, and with the objective to put the mental health in the center of the agenda, to give it resources, political, economic, and diverse resources. And for the first time, the perinatal mental health has a strategic line in our mental health plan. It was absent before that, and this is important because it puts a problem on the map. You have to mention it's performative to speak about perinatal mental health, but also to be a strategic line in the mental health plan. It entails funding for the regions in Spain where they can do projects about perinatal mental health, and they're performing, for example, to give some examples, early detection of postpartum depression, perinatal loss programs, training of healthcare professionals, or building resources for women with severe mental illness who want to get pregnant. And however, we have tried to put it in the agenda, but in Spain we have few policies now, and we have very little data regarding mental health indicators in the perinatal period, neither from surveys, from electronic health records. We're working on that now, and to have quality data to know what is happening and what can we do to solve it. I have seen the Make Mothers Matter report that says some things about Spain, but we don't really know the magnitude of what's happening, far from the conditions in which mothers get pregnant and have and live their postpartum are not easy. And we are also from the Commissioner of Mental Health Office. We're working in building a group of experts to gather recommendations to think about a roadmap for perinatal mental health. And we are working with social determinants of mental health framework. So we know that it's needed to have mental health in all policies framework, that we cannot solve it only from the healthcare system, and and that the experiences of women before getting pregnant, their biographies, their systems, their conditions of living are very important to describe and to live the prenatal, the postpartum period, and they are going to impact mental health. So we're working on that with other ministries also, and from an equity perspective, we have in Spain we have a universal healthcare system. So there's theoretically there's no barriers to have to get attention, but we know that the more vulnerable women have more barriers, and they need a more intensive attention, and they need more resources. So we're working on a perspective that gives every woman the possibility to have good conditions of life, good conditions to get pregnant, but also they given access to specific resources. Thank you.
Thank you, Clara, for this introduction and setting the scene from Spain's perspective. If I can hand over now to Peggy McGuire, please.
Thank you very much, and thank you for the invitation to represent the Institute at this very important meeting. Well, I think as MEP Andrew Kaita said, women's mental health, particularly postpartum depression, is increasingly recognised as a critical public health and social issue across Europe. And research has shown that 10 to 25% of new mothers in the EU experience significant mental health challenges during pregnancy or in the first year after birth. On my own country, Ireland, about 14% of mothers report depressive symptoms in the first year after birth, and up to 15,000 women are affected by perinatal mental health illness annually. So these numbers represent real families, real struggles, and real consequences for child development and societal well-being. And I suppose to a certain extent, we should be optimistic because at an EU level, there are some programmes that are now recognising the fact that perinatal mental health is such a huge issue. For example, the EU for Health programme Mind the Mum, which integrates clinical support, research and community engagement. And also the Rise Up postpartum depression initiative now provides a framework for consistent diagnosis and treatment across member states. Nationally in Ireland, the Women's Health Task Force in the Department of Health, which was formed in 2019, I co-chair this Women's Health Task Force, has included perinatal mental health in the Women's Health Action Plan. We produce action plans every couple of years to create to look at the priorities that women themselves have identified. And this mental health, perinatal mental health is included also in the National Mental Health Strategy. It's called Sharing the Vision. So specialist perinatal mental health services are now embedded in majority of maternity hospitals across Ireland and offering dedicated support to women with moderate to severe conditions. And public awareness campaigns like Let's Connect are breaking stigma and encouraging mothers to seek help and connecting families with community support. I think the interesting thing about the National Mental Health Strategy is the fact that it recognises that pregnancy and early parenthood are major life-changing transitions, and that the emotional aspects of adjusting to parenthood should be acknowledged and supported. And poor mental health during the perinatal period, pregnancy and up to 1 year postpartum, can harm not only the mother, but also the mother and infant relationship and interaction, and also the development of the infant and all the wide family unit. So we had a public consultation in developing the strategy. Repeatedly emphasised in this consultation was the need for better and more accessible mental health support pre, during and post-pregnancy. Yet not everything is perfect in Ireland, and many women still lack access to care. Milder cases often go undetected, so therefore are underdiagnosed and not treated. And specialist mother and baby units are limited, which means that if the mother is being treated, she's separated for her infants, but this can't continue. So we must ensure that screening is universal, as my colleague in Spain mentioned, that services are comprehensive and that data collection is robust, so that policy decisions are guided by real-world needs and not just estimates alone. I personally think that the EU has a unique opportunity here to lead by example, by embedding maternal mental health in all relevant policies, by investing in research and by fostering collaboration between member states so we can identify models of good practice. And if we can do this, we can reduce disparities in maternal healthcare, improve outcomes and ensure that every mother has access to the care she needs. And supporting maternal mental health is not just a health priority, it's an investment in families, communities and the future of Europe.
Thank you very much, Peggy. We will be diving into detail in the concrete actions that the EU can do, but thank you very much for this introduction. Now, Johanna, would you like to go next?
Thank you. Thank you, and for bringing this topic to the table. If you ask me what has been good and where are the good advancements, we know it from the legislative point of view, the initiatives of the EU on mental health, mentioning also in particular maternal mental health, that's a big advancement. Of course, these initiatives don't have yet any action plan, so there are no actions that can be delivered by that, from that. But we are pushing for that from our main organization. So from the political, let's say, policy point of view, we have advanced. This is more into why we are debating this topic in these days. We also see a change in society. Make Mothers Matter did a survey of almost 10,000 mothers around Europe, 11 countries and the UK. And in this survey, the mothers spoke. The mothers spoke about their many issues related with work-life balance, with breastfeeding, but the two areas, work-life balance and mental health, were the most shocking areas. So to give you some numbers, 50% of the survey mothers say that they have experienced or they experience some kind of a mental condition, depression, anxiety, burnout, or peripartum depression. 67% of those mothers reported feeling overload. And we have some countries where the mothers feel more this overload, and those were Ireland, Spain and Portugal. The country where they experienced the highest rate of anxiety in our survey was Spain. The highest rate of depression was Sweden, burnout was Belgium, and perinatal depression was Belgium as well. So with these numbers and many other numbers that you can find in our survey, we think that this is an advancement. Why? Because mothers are talking. Before, I think some decades ago, they were not be able to say some things. If you feel tired, if you feel depressed, if you feel with an anxiety, you would not. Will go on with the things. You would not say that in a survey. You would not ask yourself about that. So they are speaking, even though we believe that still many mothers in Europe suffer in silence, and that's what we are working for, to combat this suffering in silence. Many mothers don't look for help. The people around them, they don't know what to do. And one main thing that we see still nowadays is that we are living more in these mononuclear families where you don't have further support. Mm-hmm. So one thing that we are also asking the society and bringing awareness about this is that we need our villages to hear you, to support you. Everybody can help your neighbor who is a young mother with a child. You can offer something. You can offer to bring shopping, to do cooking, to bring something to eat, because any mother can be suffering in silence. So that's what we think, even though things have been changing and we are speaking openly about this today. We have also seen some changes in changes mentioned before by some of the speakers in different countries. The countries are trying to have maternal mental health embedded in maternal care. So in maternal physical care and perinatal and prenatal and postnatal care should be also the mental health of the mother has to be taken on board. Some countries like, no EU, but Norway is advancing on clinical guidelines on mental health. Right now, we have a member in Norway, 1,001st day and 1 day. And the last 2 weeks, they have been debated about this. The government's pushing for this, so this is a good advancement, of course, with a lot of problems, but they are also advancing. We have in Spain the care blocks, which are not only related, especially in Barcelona, to mental health, but is care support of all the people who are providing care, and among them, the most important care providers of the society are mothers.
Thank you, Joanna. I may have to stop you here because there's plenty still to discuss, but I think those are really relevant examples, and I really like what you said, that it takes a village at the end of the day, and it's important for the mothers to seek the support that they need. Now I'd like to move on to Annick Bogaerts, who is joining us online from KU Leuven. Welcome.
Thank you. Can you hear me? Yes. So thank you for inviting me. So I think effective prevention and care for mental health problems, such as postpartum depression, require moving beyond pregnancy only or postpartum only models of care, because as already said, we really need a life course approach. So recognizing that pregnancy and postpartum are not isolated episodes, but part of a broader health trajectory starting in the preconception period. And currently, we see that routine care lacks preconception counseling and integrated interventions that combine physical health components such as nutrition, physical activity, and sleep management with psychosocial support. So I think we really need a systemic change. So, and without that comprehensive life course strategy, the mental health problems will continue across generations. So governments and international agencies must act now to support women's health, not only during, but also before, after, and in between pregnancies, to avoid missing critical windows for the prevention of intergenerational transmission of mental health problems, ensuring that then the next generation inherits the opportunity and not the risk. And what we see in Belgium, we occasionally see awareness campaigns aimed at reducing stigma around mental health issues, but these mainly target the general population, not specifically the woman, and certainly not women of reproductive age. Also, and that is a good thing, I think, the Belgian government recently invested in systematic screening for vulnerability in pregnant women, but we need to be aware that screening documents are not a silver bullet, so not the magic solution or ultimate answer to preventing mental health issues. They can create a false sense of reassurance because first, screening tools are often not sensitive or specific enough if they haven't been validated for early detection of mental health problems. And secondly, it's not just about administering a questionnaire. It requires experience and specific skills to support this target group. So building a professional relationship, fostering self-confidence, and empowering women to engage in shared decision-making for their care path has far greater impact than simply completing a checklist. And moreover, when women score lower on certain parts of the screening questionnaire, there are often no tailored or appropriate follow-up care pathways available. And lastly, I think perhaps most importantly, what we learned from research from women themselves about their experiences and needs for professional mental health support during pregnancy and early motherhood is that first, their reality often does not match their expectations. So mothers reported negative feelings that contradicted the anticipated positive emotions of childbirth and motherhood. Also, secondly, seeking help, if they did so at all, was very complex. Thirdly, they said communication between healthcare providers was very limited due to fragmented care, which hindered continuity and appropriate referrals. And lastly, they noted a lack of a broader approach with current emphasis mainly on medical aspects and little attention to maternal mental health. Also, as already said by other colleagues here, there was less attention to the mother-child diet, also less attention to the mother-partner relationship. So therefore, an integrated care pathway focusing on early detection in a supportive and empathetic way, addressing mental health and ensuring sufficient social support was highlighted by the women themselves as crucial for preventing mental health problems during these critical life stages for a woman. Of course, also partners needs attention. Thank
Thank
you.
you very much, Annick. So indeed, it's, as you mentioned, it's a life course matter. It's not something that we can just like pinpoint to like one specific moment, but it requires a lifelong approach. Now, Marina, what would you tell us about that?
So thank you. Maybe just a quick word about Biogen first to explain why we're here and we support this event. Biogen is a pioneering biotechnology company that has a specification on diseases that have no solutions and have high unmet medical need. And we normally work on neuroscience, on immunology, on rare diseases, but postpartum depression kind of fits that definition. There is a clear unmet medical need. All the speakers before me have talked about it. And there's not enough awareness, there's not enough diagnosis, and there's not enough integrated and multidisciplinary care. So we know that gender inequality is not an issue that is just discovered. It's across all areas of, first, research and development. Women issues are not very well researched throughout the clinical development of solutions. And then it goes beyond that to awareness, discussion, the taboo or the stigma that we're all talking about, of talking about women's health and mothers' maternal mental health is still very, very prevalent. So how do we really intervene into this so that it's not a stigma anymore? We know that in France, women find it very, very difficult. 79% of women are saying they find it difficult to talk about their mental health issues, especially after what is supposed to be by society the most happy event in a family or a woman's life, so after pregnancy. We know that there's 6 out of 10 French women that do not know the difference between baby blues and a postpartum depression. And as we have talked with other speakers, a woman's maternal health also affects the whole family, the partner, and the child. 72% of the cost of the French health system for postpartum depression issues is actually going to the child's development that is affected by these issues. So what has been done in France to give an example of this integrated healthcare pathway that the previous speaker talked about, it has been since 2022 that there has been a specific postpartum depression care pathway that integrates this multidisciplinary support for women, starting before pregnancy and then continuing with early postnatal appointments and actually giving access to women to this psychological support. And this can be carried out by a midwife, a gynecologist, a general practitioner, and of course by psychiatrists and psychologists. In 2025, it was the year of mental health in France, and it has been recently decided to be extended in 2026. And I think it's a key thing that we can see as a best practice to have a government put that as a national priority and then try to integrate a care pathway system around. But as we all said, there's still many things to be done.
Indeed, thank you, Marina. Many things to be done, and some progress we've been seeing, for instance, from the European Commission side, the comprehensive approach to mental health. We've been seeing council conclusions. The Parliament, the European Parliament is working in its own position. But what concrete matters can the EU do? What steps can the EU take to strengthen women's health policies and particularly, let's say, in embedding postpartum depression into broader policies and guidelines. Maybe I might turn back to Peggy because you already outlined some ideas in your introductory speech, if you would like to develop them further.
Yeah, thank you very much, Jess. I think, as my colleague said, the problem I think with mental health and postpartum issues are that if there's not enough awareness around it, and there's not enough awareness among women themselves, which is a huge issue. And the lack of access for some vulnerable groups like migrants, Roma, and other vulnerable groups is a huge issue. So I think, again, the EU can take a leadership position here by looking at the EU for Health programme and to see where it can actually manage some of these issues through a program like this. And for example, exchange of good practices from other member states, number one, and also increasing the health literacy, particularly for women, which is a huge issue, I think. And then I think a colleague from Biogen mentioned also the education, I think, of healthcare professionals. If we want a multidisciplinary approach to postpartum depression, it needs to be multidisciplinary. So therefore, we're talking about general practitioners, we're talking about midwives, we're talking about gynecologists, etc. And I think there's a very good example in Sweden, for example. They have a very, very good, I think, system, and I think it's a good model of good practice where perinatal mental health programs exist through GPs and through GP practices. So therefore women can actually go to the GP, who are the gatekeepers really of health in the first instance, and talk to them. But also they have a very, very good system of, I think it's 480 days. And Joanne probably would know more about this than I would, but 480 days flexible leave for parents. And I think there's a non-transferable 90 days for men. So I think all of these issues could be looked at. But I think the research is another issue, I think. Funding needs to be ring-fenced for postpartum depression. There has been no, as far as I can see when I was looking for this meeting today, there has been no funding ring-fenced for this at a European level. Now we have the remains of Horizon Europe, but we also have FP10 coming up, for example. So I think we need to work with organisations like Make Mothers Matter and speaking to the Commission about how they can ring-fence monies for something like this. It's such an important issue because I think if we can, I think it's one part of a woman's life where intervention can have a very positive effect. I think there's certain times in a life where you can make very good positive health interventions, and I think this is one of them. And I think that should be looked at, I think, from a policy perspective. So again, I think it goes back to my first in my statement is the EU we have to have leadership. And I think the EU can give us some leadership here across the DGs, not just health, but also research as well. And maybe embed mental health, and particularly postpartum mental health, in other DGs as well. For example, like housing. We have such a housing crisis as well, which is affecting the mental health of women, and particularly women who are in crises during pregnancy as well. So there's a whole load of issues there. But I think mental health should be embedded across all policy areas.
Thank you. Maybe Joanna, you would like to go next?
Yes, I think, well, I agree with what Peggy said. Of course, we need, Europe has a role to play. The European Parliament issued a survey on mental health, women's mental health in general, and women on mental health, they said that they wanted the EU to step more in and to have even share or competences on its own to regulate these issues. So that was what the survey of the Parliament said. And thinking about other schemes, for example, where the EU can step in is to adapt and to adopt the WHO 2022 guideline on perinatal mental health, to embed it, and that all member states take these policies on board. Also, the child guarantee. The child guarantee is an important instrument where there is the recognition of the child mental health, but in order for the child to have a good mental health, we know that we need a mother's mental health. So we advocate for the inclusion of the maternal mental health within the national action plans of the child guarantee. We are also hoping that and we ask the EU Commission to put forward a council recommendation on perinatal mental health. And ensure, as some speakers have said, that in all the curriculum of all care providers, maternal mental health is included, that no matter where the mother goes to, she's been followed up, and there is a clear track of referrals that they can be referred from the generalist, from the pediatrician as well. They can also ask how the mother is doing, and refer these mothers to other competent specialists. Also, it's very important that we talk about these groups that are facing these inequalities. So one thing that we always think, and we link poverty and child poverty, we link it with material deprivation. And it is material deprivation. But what affects the most the child is not the material per se, is the mental state of the mother, is the fear, the shame, the stress, and all the emotions around being deprived that are passed on to the child. And that's what is so important also, to involve all vulnerable communities, migrant mothers, Roma mothers, mothers with no employment, single moms, mothers with disabilities. So all these groups have to be also taken on board to be completely taken care by the society.
Thank you, Johanna. Maybe Marina, what would you like to add?
So I think all speakers here talk about how Europe can take a leadership role, both in care for women in postpartum depression, but also in awareness. I would like to bring another subject, which is how does Europe encourage innovation for adapted therapies for postpartum depression. Today, postpartum depression is treated as any kind of depressive episode with chronic drugs that were developed 30 years ago, and that they take a long time to act. So they don't take in consideration this acute period around birth and this specific nature of postpartum depression. So Europe could create initiatives and incentives to make sure more research and development is done for postpartum depression, and to develop adapted therapies. And then there's the question of access. We need to make sure that all European women have equitable access to adapted therapies. It shouldn't be just national priorities or national systems, and we hope that the European Union HTA reform will give the opportunity to all European women to have access to adapted therapies.
Mm-hmm. Thank you, Marina. Maybe I could get the comments maybe from Annick and then Clara first, before I move on to the next question.
Yes, thank you. I think two things I want to bring up related to the question on the EU. I think what also is important is that we need like a health surveillance system. I think we all know Europeristat, they have some core indicators, but mainly medical health related. So I think we really lack there the mental health issues. So yeah, if we talk on a health surveillance system, so I mean, we need like an ongoing systematic collection, analysis and interpretation of mental health indicators at the population level and system level, so that we can inform, also plan, implement and evaluate efforts to optimize health between pregnancies, to improve outcomes and to reduce also the health inequalities in parents and the next generation. And second thing, indeed, I think it's related to what Peggy already brought up on the funding. We really, I think, lack funding focusing on mental health issues, although I think they need to be combined with the holistic approach. But just want to say that we are very happy because recently we started with a big European project on a healthy adaptation to pregnancy, postpartum and parenthood. And this is a European Marie Curie doctoral network project. So we aim to train 11 perinatal care innovators, and we are focusing on prevention of obesity, lifestyle issues, and they are highly associated with mental health. So what we do there is we really need to prevent fragmentation of care, to prevent too little too late. Yeah, we want to reach the vulnerable groups, and I think it's really important here if we aim to develop like a multi-component app for pregnant couples and young families, but from a co-creative development perspective. So we really take in the mothers themselves and ask them what they need, what they want to have. And we also want to test this feasibility thing in 3 European countries, and also try to identify barriers and facilitators from the perspectives of families, healthcare professionals, and policymakers. So we are very happy with that project, but I think we really need more to have more convincing implementation of policy.
Thank you, Annick. And Clara?
Okay, so I agree with all the things that my colleagues have said. Just to add something about the conditions of living and the conditions that mothers and families parent. And we're working in Spain to extend the parental and maternal leaves, and to work from the Commissioner of Mental Health Office to work on something that it's not especially related to perinatal mental health, but it's really related, that it's the relationship between work and labor and mental health. So it's very important that we invest from government, from mental health and politics framework, that we invest also not only in healthcare, that my colleagues explained it very well, but on extended maternal and parental leaves, and conditions that doesn't make the mothers lose contact with their work and with their identity of working, and with good economic conditions that allow them to be present when they are with their children, and to be safe when they are nurturing and in their family environment.
Thank you very much, Clara. Now, then let me move, because now we've looked at the European level. Now let's look at the national level in terms of how can awareness, support, and early detection and treatment of postpartum depression can still be improved across EU member states. Because I think I'm already getting some more questions around that, and systems around different EU member states and so on. So maybe Marina, you could bring the example of France, maybe, if that's there's something in particular you'd like to highlight, and then also to remind the audience, by the way, that you can ask your questions still via Slido. That also goes, by the way, for those of you joining us in person. So yeah, scan the QR code or use Slido. Go to slido.com and use the hashtag PPD. So now it's your time to put on any questions you would like our panelists to answer. I give you a couple of seconds to think, Marina. Over to you now.
So we all talked about in our introductions about the taboo and the awareness issue with postpartum depression. And I think part of it is that I see 2 areas of communication and awareness. The one, that it has to become a natural thing for women to be supported during this important period of their lives. But the second is also that postpartum depression has to be recognized to be a specific kind of depression and not just any kind. And in the French example, there's now a growing awareness in France among healthcare professionals, because the Ministry of Health has published a dedicated roadmap for better consideration of the specificities of women's health. The HTA body and the Academy of Medicine have had specific tasks and consultation this year to support professionals in changing their practices, becoming more aware of how they talk to women about mental health and women's health. But we still see that almost half of the women who report poor mental health have not consulted a healthcare professional. We also see that those postnatal interviews that are now within the postnatal care pathway in France are not used by women. They can do it, but they don't go. So we do think there has to be much more awareness, and all actors have to contribute. And at Biogen, for example, we think that as a company, we should also contribute in making it aware, and we do several events with our employees to make sure they take mental health and women's mental health as natural events in life that need to be supported.
Thank you, Marina. Johanna, maybe anything you'd like to add?
Well, I think at the national level is where health should be taken care of. normally. And so many initiatives have to come from there. I think the member states have to be more taking the leadership on that, and they should combine all policy from economic measures, from social measures. Somebody mentioned housing initiatives. Everything has to be combined, because in all these issues, employment, social measures, all have to be aware of maternal health, mental health problems. For example, as well, they should implement at the national level clinical guidelines. There is a EU funded project that produce these clinical guidelines on perinatal mental health, and the idea of this consortium was to spread this around the different countries that were partners of the project, but not only. They should come to all the countries, because if we have clinical guidelines that are clear, that can help clinicians, can help doctors, mothers, families, etc., and the governments, that I think is a very good step forward. This project is Rise Up PPD. We know also from Lithuania, I'm sorry, Ireland was already mentioned. Lithuania, the government has taken some steps to also refer the generalist, when the woman goes to the generalist, and if he finds something or if he has something, she can be referred to other doctors, and this is now a national plan in Lithuania. I think the governments have to put some efforts in funding local initiatives, because I think it's easier to support mothers where they live, and they can be provided in their vicinity with all the things that she needs. So I think these community-based services are easier to implement, are cheaper, are also easy to combat stigma, because it's easier that you go to the place you live in, and also they are tend to be more cultural, respectful, and adapt to the community. So I think governments have a big role to play to give some funding at the national, regional, and local level to support families and mothers.
Thank you, Joanna. And maybe connecting that, maybe I could bring back Clara to the discussion as representative from the government of a member state. What do you think that you still need in order to improve in terms of awareness, in terms of support, in terms of early detection? What is something else that you feel that you might still need in order to improve that?
I think Spain has a big strength in the sense that we have a universal healthcare system, which is based on primary care, and we also have a characteristic in primary care that is longitudinality, the relational continuity, that the women, when they go to their primary care center, they always meet the same professionals, that they know each other, but we have to work on training of those professionals, because they give a very comprehensive care, integrating the physical, the psychological, the social aspects of health. But sometimes there's gender bias. There's, as my colleagues have also said, there's stigma. There's many factors that don't let them detect or have meaningful conversations about how mothers are living their postpartum. And we also are trying to work on the connection between levels, because the thing that sometimes happens is that from primary care professionals, they have difficulties coordinating with each other in interdisciplinary teams, and also have difficulties when communicating with other specialists, for example, with the mental health care network, or with gynecology and on the hospital. And it's important to, when in a very vulnerable state that is postpartum, to not to make the mother be in charge of the professional connections, if you know what I mean. But that the system takes takes the leadership on going with her and communicating between professionals. And also another thing that we want to improve is the community-based resources and their connection with primary health care, because we know, as my colleagues have said also, that women need spaces, safe spaces that are very, very accessible, very close to where they live, and mutual support groups, resources that help them break the isolation, and that doesn't they don't only rely on the woman going to a primary health care center, because they make it more accessible, and they make the coordination possible and the detection possible, and hold the mother or the family more friendly.
And Peggy, is there anything that you would like to add?
I'm just thinking about what my colleagues have just said, and Joanna said that national level is so important, and I couldn't agree with her more, because implementation and service delivery is the mandate of member state governments. But I feel that there's an awful lot of member states who may have good action plans, they may want to do something, but they lack the resources. So I think it then goes back to the EU again. Can we look at something like the cohesion funds, the European Social Fund, for example, to improve access to good mental health perinatally? I mean, I think our president, Ursula von der Leyen, has now put health in economic and competitiveness and economic growth. And I think, women's health is not a niche issue. It's a foundation for social and economic well-being. So therefore, I think, we really do need an EU strategy for women's health, so that maternal health can have a pivotal and priority role within that strategy. And I suppose we've been working on that for a long time now. We're actually finalising towards an EU strategy for women's health, which includes maternal health as a pivotal intervention area and issue for women. So I do think that member states need more support. They need, for example, maybe I'm just thinking when Joanna and or Clara was speaking, probably what's needed at every member state is to bring people around the table, like women themselves, to hear the lived experience, midwives, gynecologists, and also GPs, and to bring them together to say, how can we implement a good action plan for good maternal mental health here in this country? And I think the EU needs to step up with that, and to see how they can encourage that at an EU level, either through maybe a reference point. I mean, one of these references that can be developed for the Commission, so that can bring member states together and discuss that at EU level. But I think it needs more effort, and more emphasis now. I think we need to step up to the plate, and the EU needs to step up to the plate to do something.
Mm-hmm. Thank you, Peggy. And Annick, I would like to turn back to you on one of the things that you said in terms of how postpartum depression is perhaps often siloed. Well, in reality, it's part of a broader health trajectory. So I wanted to ask you, what does an ideal postpartum mental health care pathway look like in practice? What is preventing us from achieving that? How would it look like ideally?
Yes, thank you for the question. I think it's very important, as I already said, that we don't need to have to focus only on postpartum. So it comes with a whole supportive care trajectory, and therefore I really think that preconception period is very important, because often there is a mismatch between what women expect and what they experience. And I think it's all in the preparations there a bit as well. And also the partner is very important. We often forget the partner to involve in all the care trajectories. So I think, from that perspective, if we can make an holistic program, we can reach them as early as possible. And also the continuity of care, as already mentioned previously as well, is so important. So women need to feel some trust and some self-confidence as well. And I think that's not only, we can't only focus on the postpartum period. So really there, it's a multi-component approach first, and also I think very multidisciplinary. And what we also saw from our research, so just to give you an example, we from 6 weeks onwards, so we saw that, let's say, symptoms of depression at 6 weeks postpartum, they were very predictive, for example, for increase of fat percentage in the woman of 6 months. So just to say that the physical health and the mental health are so intertwined with each other that we really need to focus on the whole multi-component thing, and that needs to start as early as possible. So we need to focus preconception, I think, and to prevent too late, too little.
Thank you, Annick. Do I get any reaction? Anything that you'd like to react to, or?
I think the only thing I would like to say is we are in 2025 and still the leading cause of maternal mortality is suicide, up to a year after birth. In France, you have a maternal death of psychiatric origin every 3 weeks, and postpartum affects 1 in 6 women. So it's not rare, but it is underestimated. And I think we have to all work together. So you have to have at the national level, the policymakers, the patient associations. That's another big issue for postpartum depression. You do not have identified patient associations that are specific to this. They're not even defined as patients. Mm-hmm. So how do we make sure this taboo stops and people and stakeholders start to be organized? And then you also have, as I said before, you have national policies. I do believe there has to be a European leadership on the funding. And I do think it's not even at the conception. I think we should start looking at means to fund innovative research to make sure you find the right way of care for this kind of underestimated diseases, but also the right way of therapies. And to do that, you can have a fund at the European level, but you can also have a fund at the national level.
Thank you, Marina, which brings me to my last question before I take questions from the audience. You said that we need to work together. So the question is, who gets to do what? So what role can policymakers, what role can patient groups and other stakeholders play in strengthening policy action for maternal mental well-being? Maybe, Joanna, you would like to kick us off?
Yes, well, many things have been mentioned from the politicians, from the policymakers. They should enable laws and rules that really cover all these issues that we have mentioned, from education, access to comprehensive maternal care, which includes maternal mental care, social laws, employment, social protection, health, of course. So the policymakers play a big role. They also have to put targets to control their own activity and their own success. They also need to monitor, of course, and they also need to give some funding to the different actors that are involved in this. So from the educational sector to the communal or local initiatives, to the different organizations that come across, like a patient organization or mothers organization or different actors that are raising awareness on this. So funding is very important. Clinical guidelines, I think the governments have the right and the power to issue clinical guidelines and screening tools that can follow the mothers. I think some places where the government also can help is on the status or how the women access the healthcare providers when a woman is pregnant. In many countries, still in the EU, there are out-of-pocket payments that the women have to pay in order to go to deliver. Of course, there is no question about mental health in those settings, but still there are many barriers at that level. The geographical distribution of the mental or the healthcare providers and the quality of those. And that's a role for the state to control the quality of the services delivered.
Mm-hmm. Thank you, Joanna. Maybe I can turn back to Peggy now.
Yeah, just listening to Joanne there, I think policymakers, they're at the core of any changes that can be made. So yes, and I agree, they must set clear mandates and fund the specialist teams And I think one thing we haven't discussed about is ensure universal perinatal screening, because without screening, we can't move forward. I think there's a package there that's needed, the screening, and as we're all talking about integrated care. So I think we need a package there for mental health. But one thing, we're just listening there, I think we need to mainstream maternal mental health into mental health strategies at national, EU and particularly national level, but also mainstream it into maternal health care and to women's health care as well, so that it becomes the norm to discuss this. Unfortunately, stigma still exists around mental health in general. So therefore, I think we need to mainstream so the narrative can change. And that's something I think we all need to work on moving forward. I think, again, patient groups, and I know Manola said there's no patient group, I think this is a huge issue. And again, we need to go back to, I suppose we need to go back to mental health organisations, patient organisations, and encourage them to start encouraging women to start speaking about maternal health, mental health. And I think this is crucial as well for reducing stigma as well, that we get this discussion going. And if we have the strong mental health and maternal health advocates there, and we can then advocate for stronger mental health within the perinatal process. And healthcare professionals, of course, we need them as well, because they're delivering at the core for early detection and also screening and also integrated care. So they need to be trained and upskilled to make sure that they recognise the fact that a woman is suffering from this, and across the perinatal, as Alex said, it needs to be done across the perinatal, not to wait. Postpartum, it's too late. It needs to be done and identified much sooner than that. So I think working together, I suppose we also need, I think somebody mentioned employers as well, that can fit into the whole employment mental health discourse as well, so that it's recognised there as well. And maybe we should even go as far back as looking at schools and having it spoken from a very early stage as well.
Thank you. I'll need you to be concise with the answers, because we have just about 10 minutes left, and I still want to get a couple of questions from the audience. Maybe Marina, you want to?
I'm just going to concentrate then on the employers level. I think everybody talked about policymakers and the rest of the stakeholders. We do know that somebody said it in the beginning, I think it was Clara, the balance between motherhood and work, and Johanna have said it, is a key issue. So at Biogen, as an employer, we have set up a support system for our employees when they come back from either long-term care or maternity leaves, to really have access to psychological support, to healthcare professionals that with all anonymity they can access through platforms that we as employers have set up. And I think that is one of the key issues. Again, this year we were voted by our employees Great Place to Work, Biogen overall and Biogen in France. And I think this makes this a norm, that you come back and you have the right support, and you know that it does take a village, and it shouldn't be a shame to ask for this support.
Thank you, Marina. Then maybe I can turn to Clara, and then I have a question for Annick.
Okay, just to add something to what my colleague said, I think policymakers have a duty to create a framework of possibility where social connection and social discourses can happen, and that includes organizing the healthcare system, in our case based in primary healthcare, to be gender sensitive and to be aware of those problems, and to be accessible and help mothers, and but also to promote at the local level that there's flexible and inclusive community-based resources, mutual help groups, and environments that are caring and are supportive for women, that don't depend on policymakers, but the conditions for them to grow and thrive, I think they depend on us.
Mm-hmm. Thank you very much, Clara. And now I'd like to turn to Annick, because I have a question from the audience related to that. Someone's asking, what is the best way for the scientific community to engage with the European Commission and Parliament to integrate science into policy, I guess related to women's health? what advice could you give? How can the scientific community get more involved?
Interesting question. Yeah, I think it's of course if you can apply for projects, which is of course a huge challenge as well if we have success rates of less than 12%, more or less. So, but if you of course have European projects, I think it's important that you can show from the science, from evidence-based perspective, that there we can really make changes by doing good science, because we already know that many interventions can have impact, but we not only need to test them in labo issues, but we need to implement them in real life perspectives. So therefore, I think there needs to be more support if we have the results from science, that we also can implement them in real life, and that's important, and that needs a continuous support, of course, because after once the funding is ending after 3 or 4 years, mostly the most projects are not proceeding anymore. So I think if we can have more support and integration there between science and European policy, I think that would be of added value.
Brilliant, thank you very much. So to wrap up this discussion and to put an end, let's look into the future. And I'm gonna take another question that I got from the audience. If we want to eliminate postpartum depression in the next 5 years, ambitious, I know, but if we want to eliminate it, what's one action that we really need to take, that we really need to roll up our sleeves? What is something we really need to do? Maybe I can start with you, Marina, very shortly.
I don't think, because it is a natural process of the human brain around birth to change, to accept a child, I don't think we can, and it's a hormonal issue too, I don't think we can completely eliminate postpartum depression. It has a biological cause. But I think what our ambition should be is that it becomes better supported, better talked about, much more higher awareness than it's right now, so that they can become a stage of life for mothers and their families that they can pass through in a positive way. So for me, the first step is how do we talk about it, and how do we encourage women to talk about it. And I think that goes to policy, to employers, to multidisciplinary teams, to education for healthcare professionals, and somebody said even back at school for our kids. So I think that's the first step to take.
Thank you. Maybe since you're already next to me, Johanna?
Well, I completely agree. Of course, this is a very important condition. And I also think that in order for us to address this topic, it doesn't mean that we are going to eliminate and then there is no woman who is going to suffer from this mental health condition or conditions. We need to profit from the fact that during pregnancy is a period of a great change in a woman's life. There is also a lot of vulnerability, but it's a very good opportunity to act, because it's a moment where all women, no matter what their background, economic, social, etc., they go and they are in contact with one health provider. So I think since that's the case, I think the ideal would be that no woman who approaches a health service during pregnancy is not being detected or not being asked, how do you feel and how are you doing?
Thank you, Johanna. And maybe I can go from the reverse order that I have in my screen, starting with Anik.
So I would conclude by saying mandate integrated maternal mental health care as part of standard perinatal services, starting with routine screening and guaranteed follow-up pathways for postpartum depression, supported by adequate funding and workforce training, I would say. And also, I think, if we are in contact with women, I should say, make every contact count by supporting them in a holistic way.
Thank you very much, Anik.
I suppose I agree with everything that our previous colleagues have said, but more awareness definitely among women themselves to reduce the stigma, and also among healthcare professionals. And that it would also mean that every mother in the EU is identified early and receives timely and culturally appropriate care. I think that's probably the most important thing, and that universal screening will be implemented in all maternity and primary care settings, and also have specialist perinatal teams, but that it would become norm that that women themselves would be speaking about maternal health and mental health during pregnancy.
Thank you very much. And last but not least, Clara.
So just to say something different, I think we have to address the social determinants of mental health in mothers, the workload, the care systems, gender bias, housing, socioeconomic possibilities, and also to start social conversations about maternity to break the stigma and to break the isolation of mothers.
Thank you. Thank you very much. Now, to wrap up this conversation, since she wasn't able to join us either, but she still wanted to be present in this discussion, we have a video message from a member of the European Parliament from Greece with the EPP group, Eleonora Meleti. So if we can have the video.
Dear friends, thank you for the invitation to address this vital topic today. Postpartum mental health remains one of the most overlooked dimensions of women's health in Europe, and we must begin with an honest truth. Women are not prepared for what they will experience in childbirth and in the months that follow, not because they lack strength, but because our systems, our structures, and our cultural narratives fail to prepare them. When I became a mother myself, I realized how profound, overwhelming the postpartum experience can be. I was shocked by how little honesty and support surrounded this reality. This is why I wrote a book about my own journey, a book that became a bestseller simply because millions of women recognize themselves in it. And if we want real progress, we must speak plainly. Postpartum mental health is not only about clinical depression. There is a whole postpartum emotional spectrum: anxiety, fear, guilt, identity lost, intrusive thoughts, exhaustion, deeply human experiences that most women face. Europe cannot meaningfully support women unless it dismantles the stereotypes and taboos surrounding motherhood. And this means something very specific. We must stop lying to women about the myth of effortless, perfect motherhood. Yes, motherhood is beautiful, but it's also difficult. It is a period in which a woman must reintroduce herself to her body, her identity, her relationships, and society. She must grieve the women she once knew and slowly discover the women she's becoming. We must dismantle the myth of the super mother, the woman expected to return to work flawlessly, be the perfect partner, lose all pregnancy weight, perform better than before, be more attractive than before, and be a perfect mom at the same time. These expectations do not empower women, they crush them. And we must not be afraid to talk about the darker, more complex sides of motherhood, not only the clinical disorders, but the very normal emotional struggles that women face. These feelings are not a weakness, they are part of the transition, and it is okay not to be okay. So, how can Europe do better? Not with symbolic gestures, but with structural, measurable change. First, by establishing a European framework for perinatal mental health, a common minimum standard of care across all member states. No woman's access to support should depend on her postcode. Second, by ensuring that every maternity and primary care system includes specialized trained perinatal mental health professionals. Mandatory training, not optional, for midwives, nurses, psychologists, and doctors. Third, through early screening programs during pregnancy and throughout the first postpartum year, integrate into routine maternal care. Emotional distress must be identified early. Fourth, by adopting truly family-centered policies. Partners must be informed, educated, and involved. Paternity leave, co-parenting support, and partner training are essential pillars. Fifth, by supporting women as they return to work. Europe must promote workplace standards that include flexibility, protection, and zero tolerance for discrimination. Motherhood must never be a career penalty. Sixth, by challenging the cultural and digital narratives around motherhood. The EU can lead awareness campaigns that dismantle harm of myths, promote honest storytelling, and support realistic expectations. And finally, by funding serious, high-quality research. Postpartum mental health is understudied, under-recorded, and underfunded. Strong policy cannot exist without strong data. Because if we truly want to support women, we must stop expecting them to adapt to systems built without them, and instead adapt the systems to the realities of their lives. Dear friends, if we want a Europe that protects mental health, supports families, and empowers women, postpartum mental health must become a priority. Thank you again for this invitation and for giving space to a conversation that Europe urgently needs. Because every time a child is born, a new woman is born too, and she deserves truth, support, and dignity. Thank you.
Thank you very much to a member of the European Parliament, Eleonora Meletti, for sharing this message and for sharing her testimony, as well as someone who has gone through postpartum depression and knows what serious consequences it has for women, for babies, for families, and for society as a whole. There's many conclusions that we can get from today's event. The need for better and more consistent screening and follow-up, the need to break the stigma, the need to talk to each other, the need to have our village and feel safe to be able to share our struggles, the role that political leadership, the data, the exchange of best practices can have in order to address, and the need to ensure access to innovative solutions across the EU member states. There's a clear takeaway that we get from today, which is that we need to move from the stigma to tangible actions. And we have right now the momentum to do so now that the conversation has started at EU and member state level. So with that, I would like to close this event. Thank you very much to our wonderful speakers. I think we had a very insightful conversation, and there's still many more questions that I feel I could have asked you. Thank you very much to everyone in the audience who has joined us either in person or online. Thank you very much to all of you who have asked your questions. We tried to get a couple of them, but I'm sure this is not going to be the last conversation on this matter we are going to have. And thank you also to Biogen for your support in making this event happen. Thank you very much to all of you, and have a great evening.